Traffic crashes and the deaths and injuries that they cause are a major public health problem in our country. In 2009 in the United States, 93 people were killed on our roads each day. That same year in Minnesota, 421 people were killed in motor vehicle crashes during the year, more than one a day. Although that is a big number in Minnesota, the good news is that 5 years earlier, there were 655 deaths. That's a reduction of 234 deaths each year. Pardon the pun, but that reduction didn't happen by accident. It was the result of a lot of work by multiple agencies. On today's episode of A Public Health Journal, we're going to look at what's helped bring about that reduction by examining the Towards Zero Death, or TZD program. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we're going to look at what's being done to reduce traffic crashes and the resulting injuries and deaths. In particular, we'll be looking at the Towards Zero Death program, or TZD, which has been responsible for much of the decline in deaths that we've seen in Minnesota. TZD is a collaborative project of 3 state agencies, the Departments of Public Safety, Transportation, and Health, in collaboration with the Minnesota State Patrol, the Federal Highway Administration, and the Center for Transportation Studies at the University of Minnesota. Joining me in this conversation today are representatives from 2 of the 3 lead agencies, Mark Kinde from the Minnesota Department of Health and Sue Groth from the Minnesota Department of Transportation. Mark, Sue, welcome to the program.
Thanks for having us.
This is going to be a fun program for me because I know, looking at some of the data, that we've had some tremendous success, and this is one of the big public health victories as we talk through this during the day, so it's going to be fun to talk about it. But Sue, maybe you could tell us a little bit about what is TZD, or Towards Zero Death.
What is TZD? Good question. TZD is a partnership of multiple agencies and stakeholders throughout the state of Minnesota. It's kind of what I would consider our umbrella traffic safety program for the state. In the past, many agencies worked on traffic safety individually. We had enforcement working on enforcement issues, engineering working on engineering issues, and health and EMS working on EMS issues. But what the TZD program does is it brings those parties together to work in cooperation towards a common vision. And in that process, we find ways that we can leverage and even make greater strides just working together towards a common vision and a common goal.
Mm-hmm. Now, Mark, I know that you worked on injury reduction for most of your professional career. Have you seen this collaboration be effective in ways that you didn't expect?
I have. I think that what has struck me with this effort is this intentionality at looking for areas to make the partnerships work more effectively and efficiently together. So you're right, while we worked for many years just in this kind of injury prevention almost bubble, thinking that we were responsible, or we could, maybe deluding ourselves that we could do it alone, it was this realization as we came to the table with the engineers and folks in enforcement and in public education awareness that we had a role in health and emergency medical services that fit in and blended with. And it's when those gears started moving in synchrony with each other that we started seeing the death rate and the injury rate start to drop. So it's been an amazing.
Yeah. So Sue, how did this change what you do in the Department of Transportation? You
Wow.
build roads and you put up barriers and you do all of this. How did this change how you
Well, we
work?
really actually started thinking about traffic crashes differently maybe than we had in the past. In the past, we always were concerned with looking for what I would consider hot spots or black spots. Where were the most crashes? And we're going to go there and we're going to fix that one intersection. And what we did differently with the TZD when we started looking at types of crashes, we started to be more systematic and proactive in where we deployed our safety resources. A very good example is looking at cable median barrier out on a freeway. We don't know exactly where that next a cross-median crash is going to happen, but we can look at our data and say, well, we've got high traffic volumes here, we've got the characteristics that maybe would contribute to a cross-median crash. Let's proactively put cable barrier on our highest volume freeway. So that's a very good example of a kind of more of a proactive or systematic, where you're taking your resources or your dollars and you're trying to spread them over many miles versus concentrating on just one particular area. It's really a different philosophy and a shift in thinking about engineering.
I think a classic example of what we've talked about in health is the data-driven decision making.
Absolutely.
And it's all of the agencies putting the data together, and then from engineering, as Sue said, well, we'll deploy these cable median barriers or other structural changes, and enforcement, looking at the same thing. Where are the areas where we need to pay greatest attention to speeding or seatbelt use or alcohol misuse, and focus on that? And then we use the same thing from the health perspective when we started thinking about the changes in our trauma system and our emergency medical responses. So it's a classic example of this data-driven decision making.
All right, speaking of the data, I do want to put up one of the slides, and we'll get back to this slide a couple of times during this thing, but I mentioned the results. So let's put on the slide, which really shows what's, basically what we're talking about. The top, Sue, maybe you could explain what this chart shows.
Sure. What this chart shows is back in about 2003, if you were to draw a trend line, you could see that the traffic fatalities actually were trending up in Minnesota.
And that's the bottom line there.
Yes, that's the bottom line, is the fatalities, correct. And so the traffic fatalities were trending up, and that's when we really decided we had to get together and figure out what we're going to do across multiple jurisdictions and multiple disciplines. And so we started our program in 2004 with a concerted effort of looking at the data and making a decision about how best to leverage the resources that we do have. And we've through that, then we have many contributing or what we call top critical emphasis areas. And some of those in the behavioral side include enforcement of drunk driving laws, of getting people to buckle up, of people not driving distracted. And then on the engineering side, what we found in rural Minnesota especially, run-off-the-road crashes. Single vehicle run-off-the-road crashes are one of the #1 killers in rural Minnesota. So we really started to look at those critical emphasis areas and then come up collectively with strategies that we could work together to reduce them. An example of that would be one of the things that we looked at was speeding is a big issue, because as Mark talks about speed and injury, people don't necessarily even realize 5 miles per hour more can make a very big difference. So we have a problem with speeding in Minnesota or in the country. People don't necessarily associate speed with a risk. And so what we ended up doing is we looked at our data and we figured out where did we have the most speed-related or aggressive driving-related fatal and serious injury crashes. And then we tried to deploy our enforcement resources and public education at the same time, saying we're going to be out there, we're going to be enforcing these laws, and we want you to slow down. And we were able to see that we can actually drive fatal and serious injury crashes down then by being more concentrated in our efforts, or strategic in our enforcement and education efforts based on the data.
So we saw the traffic crashes really going down dramatically following the TZD initiation. Yep. At the same time, the population in Minnesota was going up, and the number of miles driven is going up. So our kind of crashes per mile has really gone down even more dramatically.
Right.
That's correct. Yeah.
And that was a big change too. We used to look at crashes per million vehicle miles traveled, and then we would always say, oh, we look pretty good because vehicle miles traveled are going up, and that number's coming down, but the actual number of people being killed was actually rising. And so we kind of shifted, and now when we look at our graph, we talk about individual numbers of people, because it's the person, it's people don't care about rates, they care about the individual numbers.
That's right. Each one of those deaths is a tragedy in a family and in a community.
Yep.
Well, I'm going to talk about some of the specific interventions and some of the specific things that you've been doing, because I think it's really instructive about how we want to move forward on this. But first, we need to take a little break. We'll be back right after this message.
The average text takes your eyes off the road for nearly 5 seconds.
Welcome back. We're talking about motor vehicle crashes, or the prevention of motor vehicle crashes, with Mark Kinde from the Minnesota Department of Health and Sue Groth from the Department of Transportation. We're particularly talking about Towards Zero Death program, a program that has a tremendous impact over the last several years in Minnesota. So we saw the slide going down, and Sue, you had mentioned something about the education and engineering and enforcement. I mean, these E's. Tell me a little bit about this. The 4 E's that you were talking about.
Well, there are many things that cause traffic crashes, and sometimes it has to do with the road. Sometimes it has to do with somebody getting a flat tire or a car, malfunctioning. But most of the time, it has to do with something with driver behavior or driver error. And so we know that we all have to work together and address traffic crashes across all those disciplines. Getting people to obey the laws and don't drink and drive and buckle up and don't drive distracted and those types of things.
Yeah. So we need to educate people about what's going on. And then we need to make sure that the roads are safe. We have to engineer them.
Absolutely.
Are you also involved in sort of the feedback to the auto industry about engineering cars as we get data about that?
Absolutely. At a national level, there's a big initiative talking about vehicle technology that, eventually, and some of these things are actually already out there, where the car is going to warn you that you're going to run into the car in front of you. And even going as far as someday maybe a car driving itself, those types of things. So in the future, that's really going to be probably where we're going to see a lot of success. But in the meantime, there's a lot that we can do just as humans, and taking more care with what we do to reduce traffic crashes before the technology catches up.
All right, now Mark, I know that you've been tracking this for a while, and you brought up the data piece that public health has. What have you seen as sort of some of the biggest impacts that we've had? What are the issues? Is it the 0.08 alcohol? Is it primary seatbelt use? Is it speed limit? What have you seen from the numbers that have really helped to bring down these traffic crashes?
As we've looked at the data, what we come back to is that it's not just the one thing. The reduction in alcohol limit to 0.08, the increasing the seatbelt enforcement to our primary enforcement so that it's every seat, every ride, every time is our mantra. The engineering changes where we've had the cable median barriers to try to prevent the head-ons, cross lane traffic. The design changes to try to reduce risk of run off the road with the rumble stripes on the edges of the roads. But I think the other piece that ties in with the reduction in mortality has been the coordinated comprehensive trauma system. What we've seen from the studies nationally is that with a comprehensive trauma system statewide, we can expect to reduce motor vehicle mortality by about 15 to 20%. And we're seeing that in Minnesota. Minnesota passed the legislature authorized development of the comprehensive trauma system in 2005. And since then, that was right on the heels of the Towards Zero Death initiative beginning its coordinated approach in 2004. And so we've had the chance for trauma centers across the state, for hospitals, to do what it takes to become a verified or designated trauma center, so that from our most rural hospitals to those in the metropolitan areas, we are organized and working together in how we're treating motor vehicle trauma. Well, this extends then to the triage of the patient at scene, from emergency medical services responding, to the transfer of the patient, to how the patient's treated. And it's had dramatic changes in how EMS response, how the vehicles are equipped to respond. Pediatric trauma is different than adult trauma. And so we're making sure that our responders know the difference differences between how we care for and treat a child, for example, and how we treat an adult. And it's made.
Well, I suspect that most people in our state and throughout the country say what happens on the road, contributes to the deaths or not. They don't have any clue that it really is that emergency response. That's that once a crash happens, right, that you can save a lot of lives from that time on to when they get to the hospital and get treated. True. And that it's part of a whole system. Right. And I also suspect that you've had a change in culture within the agencies working together. Is there also a need for a culture change in how we as drivers and as passengers and as general society have about driving?
I think there's a need, lots of room for growth in safety culture. I think some of the national data that's been researched is that like 94% of people think that texting while driving is a bad idea and dangerous, but yet 35% of us have done it in the last month. It just
proves that knowledge does not change behavior.
Right. So we've got a ways to go in changing that culture in Minnesota, and we're working on it. And it's taking all these E's and all these agencies, and I shouldn't just say agencies. I want to talk about our local law enforcement and local governments and local public health too, getting out there and educating people about traffic safety, particularly our teens. I think we've seen great success recently with the graduated driver's license law, so that we've seen teen deaths actually go down with that law, but kind of the education of, driving distracted. A young driver really shouldn't have 4 or 5 kids in the car with them when they're just learning how to drive, those types of things. So we are making progress, but we've got a lot further to go.
Well, I assume that really is part of the culture that, we want to drive when we turn 16, want to have full rights, and getting parents to agree to that and kids to agree to that, society to agree to change that.
Right.
I suspect the graduated driver's license was not an easy thing to sell to the public. Did you see that?
We did. It is not easy to sell and not popular when we talk about how we might strengthen graduated driver's license in Minnesota. There's the perception, the real belief that when I'm 16 in Minnesota, I should be able to, and there's a push for 15, and like some of our farming states for 14, to be able to have someone operate their vehicle on the roadway, and the data are clear. That at 15, 16, and 17, while the death rates aren't as high, the crash rates and injury rates are phenomenal. It's not popular to talk about raising the licensed age to 18. Right.
But as a parent, I think it's very interesting because it was very easy. I had children getting their driver's license around the time of graduated driver's license coming out. It makes the parenting job actually a little easier. And so
this is the law.
This is the law. And I think that once we are over that hump, I think it's actually, I haven't heard a lot of backlash. I don't hear a lot of parents of my friends saying, "Oh, gee, I wish there wasn't that law because I want my kid to drive with 5 kids in their car." They're like thankful that, oh, that's the law. Okay, So
right, I want to talk about what's going on in the future and what's going on internationally, but we need to take a little break first.
Okay.
So we'll be back right after this message.
Looking for these? You drive buzzed. It could be one very expensive ride.
First, you gotta make bail. Then pay me to get your car back.
Your insurance premiums will go through the roof.
And my legal fees just keep adding up. All told, it could end up costing you $10,000.
Nothing kills a buzz like getting pulled over for buzz driving, because buzz driving is drunk driving.
Welcome back. We're talking about the Towards Zero Death program with Mark Kinde from the Minnesota Department of Health and Sue Groth from the Department of Transportation, who are leading the initiatives in those 2 agencies along with the Department of Public Safety. Mark, we've talked a lot about what's going on in Minnesota, a little bit about what's going on nationally, but I suspect motor vehicle crashes are not just a U.S. issue. What's going on internationally with motor vehicle crashes?
You're right, Commissioner. The motor vehicle trauma worldwide causes more deaths each year than does malaria. About 1.3, 1.4 million deaths a year. Last year, the United Nations and World Health Organization launched their Decade of Action from 2011 through 2020, aiming at reducing motor vehicle trauma, death and injury around the world, driving attention to it, seeing what we can do together, taking really some of the principles that we've applied in Minnesota with the interagency response to driving down deaths and injuries in Minnesota. The World Health Organization is taking a similar approach around the globe to try to do the same.
Do other countries do better than the U.S.? Or do other countries do better than the U.S. and some worse?
We, 2 years ago, Sue and colleagues invited Sweden to come to Minnesota to share some of their successes. And Sweden's still ahead of us, excuse me, by a little bit, but we're catching up in terms of reducing our deaths. Sweden, about 10 years before Minnesota, took I'm not sure how to say it in Swedish, but took a towards zero death approach to reducing their motor vehicle deaths and injuries. And Minnesota learned from them. Sue and colleagues took that model and said, okay, if Sweden is doing it, and then it went across the borders to Norway and Finland, and it's spreading across Northern Europe. But if they can take that approach and make it work and see the kind of success that's happening there, Sue thought we could do it here. And so Minnesota was one of the first states in our nation.
Okay. And how do we compare nationally? How does Minnesota's statistics compare to the rest of the country?
Minnesota has always had a great track record with traffic fatalities. Nationally, we have to use rates versus numbers, so we're about, I think we're second or third lowest fatality rate in our nation. And we always thought at one point even, and we were doing that well back in 2003 and 4, and people thought, oh, well, that's good enough, you know, we're the third best, but it's not. We can still continue to get better and better and better. And as we're coming down, so are the fatality rates and injury rates across the country.
Now, so you had talked about partnerships, and you know, obviously this partnership, you know, it's partnership nationally, internationally. How do you advance that partnership from this towards zero death approach? Because it sounds like that's the culture that you're really into right now.
Well, we actually do have to have a structure of some sort. So we have a towards zero death program, as we call it, and we have a leadership team, and we have different committees that work on various activities. We have an annual conference that we get together, and that's very important to share best practices. So all the 4 E's get together, and we talk about what are the emerging issues and what worked well in this one local jurisdiction, and could it be replicated in another. We're trying to look strategically at, there's a lot of players here, so where are the holes? What was maybe done in this part of the state? Like, why is seatbelt rates in northeastern Minnesota so significantly less than the metro area? So we know we have some work to do in specific areas, and so again, it's taking our resources and putting them towards those areas and working with our local partners. It's not just the state agencies, local government is going to be key to continuing to drive our numbers down.
And I think that very approach is taking it, so it's not just a St. Paul state agency issue, but it's practicing this on a regional level. And it's introducing the law enforcement partners from northwestern Minnesota to the hospital and EMS partners, to their county engineers. And in many cases, up until the Towards Zero Death Initiative, the engineers operated really in isolation from the folks in the hospital or even the enforcement. The folks in enforcement or at the hospital didn't feel like they knew who their engineers were or that they could speak the same language. And the Towards Zero Death approach has given them a common vernacular, a common language, and made it say, you know, we can do this in Thief River Falls and Pennington County, and it's not a Ramsey or Hennepin County kind of focus. We can apply it specifically.
Right. In the last minute we've got, I'm going to give you each about 30 seconds to say, what do you think needs to be done next? What are the issues that we need to focus on in really getting towards zero death? Sue?
You know, I go back to the culture. I think we really have a long way to go. Distracted driving is becoming more and more an issue, and we need to get people to start thinking a little bit more about what they personally do and how that might affect the outcome of our numbers. So, to me, safety culture is probably it's going to be the hardest nut to crack. But then there's lots of things on the horizon as far as technology goes with the vehicles and in the cars that I think are going to be key in 10 years from now. We're going to be working in a different world, I think, as far as technology goes too.
Mark, what do you think? What needs to be done?
I think we need to continue the commitment to working with and honoring and respecting the skills and contributions that the agencies and individuals bring to it. And we need to expect that we can drive the deaths to zero. We can make a difference. We can make a change, but we've got to keep talking it and keep believing that it's going to happen.
Right. Well, you guys have done a great job of explaining it, a great job of putting this program together. Thank you for the contributions you made, and good luck on getting towards zero deaths.
Thank you for having us. That's
Good.
great.
I'll be back with a closing comment right after this message. The Institute of Medicine defines public health as what we do collectively to assure the conditions in which people can be healthy. Traffic safety is a perfect example of this. One agency by itself could not have reduced traffic fatalities in Minnesota to the level that they are today. It took the collaborative effort of multiple partners who could focus on multiple initiatives in areas like education, enforcement, engineering, and emergency medical services, and many more. This collaboration has had tremendous success. This made me wonder, what would happen if we used this approach on other health issues like infant mortality, teen pregnancy, obesity, and cancer? All of these problems are not caused by one single thing. They are the result of many risk factors coming together. And the possibility of their resolution also resides with many agencies and organizations, not just with the medical care system or the public health system. Wouldn't it be interesting to see what would happen if all of the agencies and organizations now working independently to improve our lives actually work collaboratively on addressing these major health issues? Towards zero deaths would then have even broader implications. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.